Endometrial cancer is rising in the United States and has now surpassed ovarian cancer as the #1 gynecological cancer leading to death. The American Cancer Society says for white patients, rates are going up about 1% each year, and for non-white patients, the increase is as much as 2 to 3% each year.
And it's one of the few cancers where both the incidence and death rates are rising.
These are cancers that form in the inner lining of the uterus, and researchers at Dana-Farber Cancer Institute have been prioritizing clinical trials to try and reverse these troubling trends. Back in 2017, Dr. Ursula Matulonis says the team put research efforts into 3 different areas: the anti-PD-L1 immunotherapy avelumab in mismatched repair endometrial cancer. This research has led to multiple clinical trials testing different combinations and has helped change the understanding of endometrial cancer. Researchers also looked at the combination of a CDK4/6 inhibitor, abemaciclib, plus a drug called letrozole. The trial showed combining these 2 drugs provided a 2-prong attack on ER-positive endometrial cancer.
The results of this trial led to inclusion of this therapy now on the NCCN guidelines. The NCCN stands for the National Comprehensive Cancer Network Treatment Guidelines, which really kind of set the stage of how we treat our patients.
And the third area of focus is something called replication stress, where DNA duplication is slowed or stopped, a genomic instability that is a hallmark of cancer. Dana-Farber recently received a grant from the National Cancers Institute to study replication stress. Welcome news, but Dr. Matulonis says more funding is needed. Of the 17 cancers funded by the NCI, endometrial cancer receives the least amount of money.
The funding for this cancer still needs to catch up.